orthopedic surgeon who subspecializes in sports. I'm a rugby fan. You can tell that I'm a supporter of the All Blacks. And in this period where we are doing a lot of home-based exercises, we can foresee that some of our patients will come with different types of injuries, and I'll be discussing these with you in a short while. The benefits of doing home workouts is that, of course, it keeps your joints moving and active. If you can perspire during the actual workout itself, that will actually give you some cardiovascular benefits at the same time. So when it comes to injuries, injuries can occur either in two different categories. One, obviously, if you're not careful, okay, you have an accident. So you can fall, you can sprain, and you can twist something. Okay, so the good thing is that because you're in the indoor space, the amount of energy or the speed that you put into the activity will not be that high. So even you have a sprain of the ankle or you sprain your back, usually within some limits, it should recover quite well. The other mechanism is through repetitive injuries. That means you do the same activity for too long and you get these aches and pains. That's where wear and tear takes place. So repetitive strain can sprain the joints, or you can actually sprain the ligaments, and this causes inflammation, loss of function, and inability to resume the activity, or even doing normal activities like walking. So when it comes to exercising at home, equipment-wise, I think the main thing about exercising at home is that you want to use your own body weight, so calisthenics, to push against as resistance. So your body is actually the equipment. Obviously, there are things that you want to put around it, such that you do not slip, you do not fall down. So having an exercise mat, like a yoga mat, or a non-slippery surface will certainly help. You don't want to be, doing burpees in the bathroom where it's slippery, right? So for sure, a nice yoga mat will help. Other things are optional. So having dumbbell weights, having, I guess, sacks of rice, or even like me, you have children, you can put them on your back and you carry them if they don't disrupt your own session too much. So the common sense things like having a mat, having enough space. So space also is a premium, but you don't want to bump against the wall or against the mattress, the chair or the bed, and get yourself injured. The last thing to consider is to make sure you exercise in a well-ventilated area, because if you are going to exercise in a very intensive way, for sure the heat load will go up, and you can actually get heat injuries if you aren't careful. Okay, so ventilation, like getting a fan or maybe switching on the aircon, is a good option. So as a knee surgeon myself, I see a lot of knee injuries routinely before COVID and now even during COVID. Most of the injuries that can occur in a home exercise circuit environment usually occurs around the front of the knee joint. So if I can illustrate, right, this is a model of the knee joint, and this is the front of the knee, okay? The knee is actually a very complex joint. It's actually the biggest and most complex joint in the body. Biggest in terms of the surface area of cartilage. Complex because it has 3 separate compartments and 4 ligaments and 2 special structures called meniscus. Now, when you're dealing with home type of activities or home type of exercises, a lot of the work is actually done during flexion and extension. That means the knee is flexed and the knee is extended. So when you see the movement, a lot of the wear and tear, a lot of the injuries can occur in the front of the knee. So this is what we call an anterior knee pain syndrome. It can occur within the joint itself or can occur outside the joint. When it's outside the joint, it would would refer to the tendons. So the quadriceps tendon or the patellar tendons can be strained. If it's actually the anterior compartment, then the cartilage can also be worn out. These are the things to look out for when you're actually doing a lot of from squat to stand type of movement. And if you're not careful, you can injure these structures. Now, like I mentioned earlier, when you start having some symptoms around the front of the knee, the first thing to do is to rest it. You could ice it if it's actually in the front, yeah, and elevation can help. But if the swelling occurs around the whole joint, then you will need to really curtail your activity and seek professional help, because that means the damage is actually occurring within the joint already. So that's not a good sign if you have a diffuse swelling. If it's localized, then rest, ice, allow the injury to heal up, and then maybe can try again. Okay, so in summary, I think after my discussion about all the different types of problems and things to look out for during a home exercise, I hope everyone can stay safe, stay healthy. It's good to exercise to keep the joints active, but at the same time, do take the precautions. And if you do get injured, do look after yourself, give yourself a chance to rest and recover. And if that doesn't happen, then seek medical treatment early, and we are always willing to help. Thank you.